Many of us have spent the last year and a half staring into computer screens, working remotely, virtual learning, and even attending Zoom conferences all online. But is all of that going to affect us long term? Dr. Sue Simpson from Eyes of Texas is joining us this afternoon. Dr. Simpson, are you seeing more patients this year dealing with sight issues as opposed to other years?
Yes, I can say that the past year and a half, we've had more patients complain to us about eye issues that are often related to an overuse of digital devices. I found that because people are working remotely and schools are closed, that people spend over 13 hours a day using their digital device, and tablet use has increased triple, three times as much, and digital device on their cell phone has doubled. So a lot of this does cause visual strain.
We're hearing some about computer vision syndrome. What is that?
Very good. So computer vision syndrome is when you have asthenotic symptoms such as headaches, pain around the eyes, and most commonly dry eyes. And with dry eyes, you're going to have symptoms like burning, redness, irritation, foreign body sensation. And often this is due because we're not blinking as often as we should. Typical blink rate is about 16 times a minute, and then when you're on your digital device, it drops in half, and that comes along with more symptoms associated with it. So often what I'll tell patients is do what's called the 20-20-20-20 rule, which means every 20 minutes you'll look 20 feet away for 20 seconds to rest your eyes, and then I add an additional 20 seconds on it where they close their eyes, they bathe their eyes with tears, and that helps rehydrate them so they don't have as much dry eye symptoms.
And are these issues treatable? Are there long-term effects from all of this?
Most of them are treatable. Sometimes patients will even complain that after they've done computer use for an extended period of time, when they look far away, they notice it takes longer to clear up their vision. And then when they go back to their computer use, then they have to blink and clear it up again. So it takes longer for their eyes to focus. And often this is treatable with a pair of computer glasses so that the glasses do the focus. The patient doesn't have to work so hard and their muscles don't fatigue as quickly.
Are you worried about younger kids being exposed to a lot of computer time at such a young age? Do you think that that's going to have long-term effects on them and their vision?
Unfortunately, I agree. What they have found is that myopia or nearsightedness tends to progress more quickly for children up until the age of about 18 years of age. And so the more close work you do, the quicker you get nearsighted. And they found that if a child will go outside just 1 hour a day, that will reduce the progression by up to 50%, which is significant.
Now, what about these blue light glasses? I feel like they've become more popular over the last couple years. Do they lessen the effects of continued screen time?
Blue blockers are good. They are new technology. They will improve over time so that they block more blue light than they have now. Blue blockers presently block about 30% of the blue light spectrum band, and hopefully soon they'll be up to 95 or 100%. But blue light does block melatonin, and melatonin is what helps us relax before we go to bed. And so I often recommend to my patients, turn off your digital device when you go to the bedroom, or if you must use it right before you go to sleep, then turn on the devices that have the blue blocking effect with it so you can get a better night's rest.
Yeah, I know a lot of people that have those glasses, and also there's an effect on your phone that you can make that a little bit easier on your
Yes.
eyes. All right, Dr. Sue Simpson, she's with Eyes of Texas. Thank you so much for your time today.